Dr. Shapiro, so if we understand how to make this diagnosis of irritable bowel syndrome, why is it sometimes difficult for patients to arrive at that correct diagnosis?
There are multiple different factors, probably some pertaining to patients, some pertaining to the healthcare providers. So I think a lot of patients suffer in silence. And we as gastroenterologists really want patients to come forward and let us know that they're having pain and altered bowel movements because there are so many things we can do to help them. There are some studies that have demonstrated this, that less than half of patients with irritable bowel syndrome seek the care of a healthcare provider, and so we want patients to know that they're not alone. The other piece of that is finding a provider who has enough expertise with IBS where they're comfortable and confident making the diagnosis of IBS. I think we see a lot of patients who have had multiple very extensive workups, which include labs and imaging studies, x-rays and CAT scans and endoscopy. And at the end of that, don't have somebody to put that all together and give them a diagnosis. And so patients often walk away having been worked up extensively and still don't have a diagnosis and haven't started on the treatment path. And so I think one of the things, and we refer to this as a positive diagnosis, but what that really means is finding a provider who does enough tests, is familiar with the diagnostic criteria for irritable bowel syndrome, and is comfortable saying, right now, we don't need more testing. This is what you have. It is called irritable bowel syndrome. And here are some of the treatment options that we can use going forward to try to improve your symptoms.